Students, so in this class we're going to learn about what is cardiac output. So the main function of the heart is to pump the blood, and hence cardiac function can be quantitatively expressed as amount of blood pumped out per unit time, which is called as cardiac output. Cardiac output depends on oxygen carrying capacity of the blood. So in today's class, we're going to study under the following headings: introduction, definition, normal values, some of the important terms related to the cardiac output, the determination of the cardiac output, how the cardiac output is distributed, what are the different variations, what are the different factors affecting cardiac output, and how cardiac output is regulated. And we'll also try to know what are Starling families of curves, and we'll try to know what are some of the applied aspects related to the cardiac output. By definition, it is cardiac output is the volume of the blood pumped by each ventricle per minute. The output of the two ventricles is normally equal. That means both right ventricle and left ventricle pumps out same amount of blood. Stroke volume Stroke volume is the volume of blood pumped by each ventricle per beat, and cardiac index is the cardiac output is expressed per unit body surface area. Okay, so normally it is around 3.2, and cardiac reserve is the difference between maximum cardiac output uh, and resting cardiac output. Okay, so usually very high. The difference is very high in case of trained athletes, and it is very much less in cardiac reserved patients. Coming to the normal values, cardiac output is around 5 liters per minute for each ventricle, and it can be increased by 5 to 7 times. Cardiac output can also be written as stroke volume into heart rate. Okay, so it is the multiplication of stroke volume into heart rate, where stroke volume is around 70 ml per beat. Around 70 ml of blood is pumped with each beat. Cardiac index is, as I told, it is around 3.2 liters per minute per meter square of body surface area. So this cardiac index is little higher in case of males and children's. Cardiac reserve is around 15 to 25 liters per minute. Okay, so usually it is expressed as a percentage of normal. Some of the important terms, we should know that end diastolic volume is around 120 to 130 ml, where end systolic volume is amount of the blood remained in the ventricle after the ejection, that is around 50 ml. Ejection fraction is around 60 to 65%. It is the index of myocardial performance. Venous return always is equals to cardiac output, and it is around 5 liters. So venous return is amount of blood which reaching to the right atrium, and mean systemic filling pressure is around 7 mm of Hg. Okay, and obviously it is depends on the blood volume. If the blood volume is more, the mean systemic filling pressure is going to be more. Methods of determination of the cardiac output. So usually it is done by fixed principle, in that using oxygen utilization. Second one, by using carbon dioxide elimination. The second, indicator dilution method. Okay, so mainly it's very similar to the dye dilution technique. So here Evans blue or cardio green will be used. Second one is thermo dilution method. Instead of the dye, here the temperature is utilized for the measurement of cardiac output. Then ballistic cardiography, pulse pressure record. cardiometers or electromagnetic flow meters and echocardiography are the other techniques which are used to determine the cardiac output. Fixed principle states that the amount of the substance utilized by any given organ is always equal to the arteriovenous difference of that particular substance times the flow. Okay, so this is the fixed principle. In most of the organs, the blood which is flowing through the organs can be calculated by using this fixed principle. Okay, so here we are utilizing oxygen utilization by the lungs. Okay, so that equals to the amount of blood flowing through the heart during each cardiac cycle. Okay, so that is why we will be measuring, uh, here we are calculating the blood flowing across uh, the lung. Okay, so here what we have to record here, oxygen utilization by the tissue, that is equal to oxygen uptake in the lungs. The cardiac output of left ventricle is equal to cardiac output of the left ventricle, that is equal to pulmonary blood flow, as I mentioned, per minute. So the total amount of substance is equal to volume into concentration. Okay, so uh, considering all the equations, so cardiac output can be measured by using this fixed principle. Okay, so that will be oxygen uptake in the lung per minute divided by the arteriovenous difference in the oxygen concentration per 100 ml. Okay, so we have to calculate the concentration of the oxygen when it reaches the lung, and then we have to also calculate the oxygen concentration when the blood leaves the lung. Okay, so that will be your AV difference of the oxygen concentration. So normally oxygen uptake per minute is equal to 250 ml close. It can be calculated by BMR apparatus. Okay, and oxygen concentration of the mixed venous blood will be 15 ml per 100 ml. So this is done by cardiac catheterization, taking the blood from the right ventricle, and the oxygen concentration of the arterial blood is 20 ml per 100 ml. So you can take the blood from any artery here. So cardiac output ultimately calculated will be around 5000 ml per minute by the fixed principle. Okay, so advantage of this method is it is accurate. Some of the disadvantages, are it requires expertise and hospitalization, and cannot be used during exercise, and apprehension of the patient may change the cardiac output. Okay. So, and the second method, which is less commonly used, utilizing the fixed principle, but here instead of utilization of oxygen, release of or removal of carbon dioxide is going to be utilized. So the cardiac output can be given by carbon dioxide expired per minute divided by the venous and arterial difference of carbon dioxide. Okay, so into 100. Okay, so that is going to give you uh, the blood flow which is going across the lung, and that will be equal to cardiac output. The next method is the Hamilton's indicator dilution method. So here dye is used. It is similar to dye dilution technique. Okay, and again probably fixed principle is used here. So here the dye should be non-toxic. It should remain in the circulation for a longer time. Okay, dye used is usually Evans blue or cardio green. Where the procedure is, initially you inject a 5 milligrams of the dye, and you collect the arterial samples every 2-second interval, and also you have to calculate the concentration of the dye in those samples. Okay, so then a graph should be prepared using a semi-log paper. Okay, so that graph will be again, concentration against the time. So this is the semi-log paper and the concentration of the dye recorded after frequent intervals. So with this, cardiac output can be calculated by this formula: amount of dye injected into the circulation divided by mean concentration of the drug into the circulation time into 60. Okay, so here the mean concentration of the dye is going to be calculated by the extrapolation of the graph. Okay, so the area under the curve, it will be the average, the amount of the dye during the one circulation time. Okay, so here the time taken for one single circulation is almost equal to uh, 30 seconds when you extrapolate the graph. Okay, so the concentration in this graph, first it increases and decreases, then increases due to the recirculation. Okay, so the extrapolation of graph on time scale gives time for the single circulation time here. So here it is almost 30 seconds. Okay, so using this formula, using these values, cardiac output which is measured will be around 5 liters. So thermo dilution method, it also similarly it uses the fixed principle. The amount of the heat released or utilized by a particular organ is equal to the artery venous difference of the temperature times the blood flow. Okay, so here cold saline is introduced into the right atrium and the serial recording of temperature of the pulmonary arterial blood is done. Okay, so the change in the temperature is inversely proportional to the amount of blood flowing. Okay, so the ballistic cardiography technique, it it uses the third law of Newton's principle, that every action has an equal and opposite reaction. Okay, so a subject will be mounted on the spring mount table and the recording of the wave produced from during each heartbeat. Okay, so the each heartbeat is going to move the body, so that the body movement will be detected by the table. Okay, and by using a different formula, the the cardiac output can be calculated. Okay, so that is the technique used in ballistocardiography. Then pulse pressure record, uh, then the direct method, where in the open chest the cardiometers or the flow meters are inserted in the aorta, so directly we can calculate the amount of blood flowing through the pressure transistors. Okay, so then echocardiography also will be used to measure cardiac output by indirectly measuring the end diastolic volume, end systolic volume, and the stroke volume. Okay, so there can be variation in the cardiac output. Okay, so it depends on the age and gender. Okay, so sleep, moderate change in the environmental temperature, usually there won't be any changes, much changes, but cardiac output drastically increases with anxiety, excitement, and exercise, and by after metabolism, after the meal, it is going to increase. Okay, so here basically it occurs because of the increase in the sympathetic stimulation. Okay, and with higher temperature, because of the in pregnancy, because of the increase in the blood volume, the cardiac output is going to increase. Okay, so epinephrine, by increasing the heart rate, I mean, to a certain extent, it is going to increase the cardiac output. Okay, so the cardiac output will be reduced in case of sitting or standing from lying position, rapid arrhythmias, and some of the heart disease where the myocardial contractility is reduced, the cardiac output will be reduced. So, so in less, the cardiac output will be less in old age due to decreased heart rate and stroke volume. Okay, so cardiac output is 10% less in case of females. So almost 5 liters of blood gets distributed to the different tissues. Liver reserves almost around 1500 ml per minute. Kidney receives 1200 ml per minute. Brain receives 750 ml per minute, and heart receives 250 ml of blood per minute. Okay, 70% of the total cardiac output, I mean, goes to the vital organs, and the remaining is will go to the muscles and skin. So here we're going to discuss some of the factors that are going to affect the cardiac output. Okay, so as we know, the cardiac output is equal to stroke volume into heart rate, and whatever the changes that affects the stroke volume and heart rate, they are going to affect the cardiac output. Okay, so therefore the cardiac output is altered by the changes in either of these factors. Okay, so the details of these we are going to learn in the next class.